Hello and welcome to this podcast, brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm, a former surgeon and presently chairman of the Isle of Man Anti-Cancer Association.
And I'm Sandy, the Executive Officer of the Association and a cancer survivor. In this podcast, we want to talk a little bit about coughs. Coughs are a frequent symptom that affects us all at varying times throughout the year, although they tend to occur more frequently in the colder weather associated with our winters.
We all know what a cough sounds like, but what actually is a cough? Coughs arise as a reflex to try and clear something that is irritating our airway. When something other than good air gets into our air passages below our throat, our vocal cords close momentarily and our diaphragm and chest muscles suddenly contract, building up pressure in our airways. Our vocal cords then partially relax and a short rush of air is suddenly released. This is often repeated several times over a number of seconds, with increasing force until the offending material is expelled. The sound created is due to the rush of air passing over our vocal cords.
So what sort of things trigger a cough? Well, it could simply be from some food or fluid that's gone down the wrong way, or some dust or smoke that we've inhaled and will only last a short period of time. Probably the commonest cause of a cough is from inflammation of the airway or lungs, resulting in a cough that may persist for a number of days or even a week or so. If the airway gets damaged from chronic or recurrent infections or inhalation of irritating cigarette smoke over a number of years, then the cough can become more persistent. Occasionally, a growth or tumour of some sort, either in the voice box, the air passages or the lungs, can produce material that can also lead to a persistent cough.
So what we are saying is that there are a number of different situations or conditions of which coughing can be one of the presenting symptoms. Yes, coughs can arise simply as a result of something unusual in the air we inhale, such as smoke, dust, fluid or food. It can also arise from an infection of the lungs or air passages caused by a virus or some sort of germ. However, when a tumour develops in our air passages, it can also irritate the airway, giving rise to a cough, either by producing mucus or by bleeding or by partially blocking the air passageway, leading to an infection.
So when should we get concerned about a cough? A simple cough with no other symptoms should get better on its own or with simple remedies from the chemist in a few days. There are many treatments that your local pharmacist can recommend to alleviate some of the symptoms depending on the type of cough you have. Similarly, if you have a runny nose or a cold or feel you have a bout of flu, things should get better in a number of days or a week or so. If you notice you are coughing up clear phlegm or sputum, simple mucus produced by the inflamed airways, this should also get better fairly quickly. However, if you have a simple cough that lasts more than 3 weeks, or you cough up sputum, spit or phlegm which is yellow, green or brown in colour, or even contain blood, then you should visit your GP. In most cases, you may simply need an antibiotic, but your doctor may want you to have a chest x-ray too. If you have a cough and pain in your chest or shoulder, you should go and see your GP.
Put it another way, you need to go and see your GP if you have a cough that persists for more than 3 weeks, if you have a chronic cough but this has got worse over the last 3 weeks, if you are coughing up spit that is not clear, and particularly if what you are coughing up is discoloured or contains flecks of blood, or if you also have pain in the chest or shoulder, feel tired or lose weight.
It's very important that you go and talk to your GP if you have any of those symptoms so that tests can be carried out, a diagnosis established and appropriate treatment for the condition started. For more information, you can visit the Macmillan Cancer Information Centre or contact them by telephone on 650735 or visit their website, which is macmillan.org.im. The Cancer Research UK website also has a wealth of information, and they are on cancerresearchuk.org, and that's about regarding cancer awareness. Thank you very much for listening.